All right, welcome to today's webinar for the desk worker. And today we are going to be discussing low back pain. We're going to really try to get you to understand and prevent low back pain. It's one of the biggest issues we're seeing amongst our desk workers. And so this presentation for you, about 30 minutes or so, will give you all of the information you'd ever want to know about low back pain, and then obviously how to prevent it. There's some core aspects of prevention that we're going to cover today and really get you on a good path of not having to fall into some of the conditions that we're going to discuss today. And so without further ado, we're going to get into some of the information on the back. And so essentially you got to understand that this relates to everybody. You know, everybody is having back pain, unfortunately, and the numbers are staggering as far as in America, where 80% of Americans have debilitating back pain at least once in their adult life, and it's causing all kinds of issues as far as loss of work, activities of daily living. It's affecting just our quality of life in so many ways, but it can be rectified. It really can, and that's what we want to discuss today. And so understand that this is really second only to the common cold for missed days at work. And it's, one of the realities of today's life is the majority of Americans have seated jobs. 150 years ago, maybe that wasn't the case. A lot of farmers, a lot of industrial workers, a lot of physical laborers. But today, as our society and our technologies have changed, it's putting us into the seated position, and there's just a lot of negative aspects of that. Now, the good news is it doesn't have to be. Like, you don't have to fall into these pain conditions, and that's why, frankly, we're here to help you out. But as a kind of precursor to the rest of this presentation, what I really want you to understand is that when you're in the seated position, it's putting 30 to 40% on average increase in intradiscal pressure. And the intradiscal is they're referring to the disc. And so you're putting a lot more pressure on that disc, and it's causing all kinds of disc-related pain, symptoms, muscle issues, and just a variety of conditions. And so sitting is an activity, and sitting is a stressful activity. Okay, when we discuss a lot of overuse injuries, we always discuss overwork, and sitting for prolonged periods of time and for many hours per week. I mean, think about it this way. If you drive to work, your day usually starts by, maybe sitting and having breakfast, and then sitting and driving to work, say 20 to 50 minutes or so, give or take. Then you sit at work all day. Then you sit back in the car to drive home. And then you sit and have dinner. Then you sit and watch TV. And then you go to bed and you start the whole thing over again. And even if you're super active, like let's say you work out 5 days a week for an hour and a half, per session, that sounds great, but it's not even that many hours compared to the, say, 60 to 70 that you're sitting. And so we're seeing this real big problem, because even the active folks, if they're not doing corrective exercises, but like let's say they are going to the gym, or they're a triathlete, or they play tennis 3 days a week, or just anything like that, what ends up happening is you actually carry the physical or the deconditioned syndrome of sitting to your sport. And so it's not that the sport actually corrects your issues. It actually sometimes, and a lot of times, it actually emphasizes them, unfortunately, and causes them to exacerbate and then lead to the actual problem. So take that into consideration, that you need to be addressing some of your workstation aspects that we're going to discuss, as well as you need to be doing some corrective exercises. And we're going to give you a handful of those at the end of this. All right, before we move on into the details of the spine, as far as the conditions, we're going to give you some anatomy, and it won't be too complicated. I just want to make sure that you understand what your spine is for. It's to protect, it's to give you motion, it's for shock absorption, which is really the disc, okay? And it's also for support and stability. You need all those things to have a healthy spine: neck, mid back, lower back, extremities, things like that. So definitely understand that. As far as the kyphosis and lordosis, that's just the name we give to the curves, and you can see in this diagram, or this picture here, of this seated silhouette, the spine's in red, and The cervical spine or the neck has a lordosis to it, which curves kind of to the anterior. The thoracic spine or the mid-back has a kyphosis, which kind of curves around, like kind of rounded. And then the low back is a lordosis or the lumbar spine, and that's kind of arched again. So that's the normal aspects of the spine and the actual positioning that we want. What ends up happening, unfortunately, in a lot of today's society is a loss of the curvature. And when you get a loss of the curvature, and again, you can see this image here, a gentleman in picture A has good posture and what we consider neutral spine, and a gentleman in picture B is in slouched posture and he's lost the curves. And when you get into that position, which a lot of us are in, when we're sitting, standing, looking at our phone, things like that, we have a decrease in range of motion, we have a decrease in strength, muscular imbalances occur, we increase our chance of injury, we increase disc pressure, like I mentioned, and lastly, what happens is when we're in neutral spine, which is good, our spine is 16 times stronger on average in that position. And so losing the curvature of the spine is the kiss of death for the back and frankly for the neck, the shoulders, the knees, things of that nature. But obviously today's presentation is on the low back pain, but loss of curvature is huge. And typically when we're in the seated position, we get a loss of that lumbar lordosis or a flexion in the spine, so kind of like rounded, instead of that neutral spine that we so desire. And that's really causing a lot of the issues that we have. Okay, moving on to some of the common low back conditions. Again, just a little disclaimer, this, we're not diagnosing anybody. We're not saying anybody has this. There's more conditions to this. This is some of the most common ones that we see. And just give you kind of a 30,000 foot overview of low back conditions. The first one I'm going to dive into, I'm going to skip the mechanical low back pain. It's kind of just generalized low back pain with no real derangement or concern of the disc and things like that, but I'll go back to it. Let's go to the disc. And, the big differentiation I want you to understand is disc herniation versus disc bulge. And the best analogy I can give you audibly here is a jelly donut. So if I took my palm and I just place it on top of the jelly donut and I, just press down a little bit, that would bulge all the way around the donut. If I took my fist and I hit the top of the donut, the jelly would squirt out, and that would be a herniation. Okay, herniations are worse than bulges. If I MRI'd 100 healthy 35-year-olds and I MRI'd their low back and they had no low back pain, a vast majority of them, a lot of them would have disc bulging with no symptoms. Not as many would have disc herniation. Now, you can have disc herniation without symptoms, and you can have disc herniations with symptoms and then get them better without surgery. Okay, so definitely understand that. And you can just have regular discogenic pain, which is just pain emanating from the disc and being inflamed because of maybe some tearing in the annular fibers. So a little bit of anatomy of the disc is that the annular fibers are like the dough of the jelly donut, and the nucleus is like the disc is like the jelly of the donut. Okay, and you can tear some of those fibers, and that can cause some pain. And so you can have disc-related pain without, say, it being a glaring herniation. And there's a bunch of, there's some subcategories of herniations that I'm not going to dive into, but that's some of the details of the disc. And then obviously one of the big concerns everybody has is their sciatica, right? And so if you do have a disc herniation, it can cause sciatica because it'll herniate out and it'll irritate the nerve root that becomes the sciatic nerve. And essentially you've got the spinal cord, and then you've got nerve roots that come out of the vertebra and then go into becoming different nerves. And in the lumbar spine, it becomes a sciatic nerve, which goes down the back of your leg. And as you can see in this image, the person's got this red, kind of heat-looking thing going down his leg, and that's kind of indicative of sciatica because it goes down the back of the leg. And yeah, disc herniation can cause sciatica, and there's certain things we look for to rule that in or rule that out. But you can have something else cause sciatica, which is below this one here, and that's called the piriformis syndrome. In some people, the piriformis muscle, which is just an external rotator of the hip, will actually, some people, the sciatic nerve runs through that person's piriformis, and others it runs by it. But either way, it can kind of tether to it and get some scar tissue when the piriformis gets tight or riddled with some scar tissue and cause similar symptoms to, say, a disc herniation, right? But it's not coming from there. And that's a huge distinction to know so that you're getting the right treatment. And so that's definitely something that we always want to rule out and is very common. A lot of times it's coming from the hip. And there's certain things we do to try to rule in, rule out. MRI is one, things of that nature. Another thing that I want to, before I move to myofascial or muscular pain, is give you the distinction of the difference between radiating pain and referred pain patterns. Okay, so radiating pain is that nerve pain that's like shooting down like a tracer. You can kind of trace down the leg or arm where it's at. It's typically, pain, sharp pain, nerve pain, burning. It can be weakness, numbness and tingling, all kinds of things like that. That's typically going to be your radiating pain, whereas referred pain is more of just a generalized, sometimes when you have pain or like a trigger point, your brain doesn't necessarily compute exactly where that pain is. And so a lot of times we'll find a myofascial or muscular pain in the low back, like this trigger point, and it refers pain down like the glute, the butt, down a little bit, but it's a little bit more of a vague pain pattern. And when we can reproduce that symptom by getting on the trigger point, we know we're kind of in the right area, and we have we have something going on with that particular muscle. So that's the myofascial or muscular pain. And then facet syndrome, you have these joints in the back of your spine, and if you go into extension of the lumbar spine too much, like some people have too deep of an arch of a low back, and they can irritate those facet joints, and it causes facet syndrome, which is just low back pain, but it is specific to those particular joints. And I won't dive too deep into that one. Spinal stenosis is a good one to kind of wrap up with as far as the common conditions we see, and a big distinction that we need to go over. This is a generalized age thing. If you're above the mid 50s or so, you're going to have less chance of disc herniations, because the reality of it is you're probably lost a lot of the hydration of that disc, and it's degenerative, and so that nucleus or the disc is not going to herniate as much, probably not, because it's just not a fluid-filled substance anymore like it was where it can herniate. But you tend to, since you are at that age, generally speaking, have a higher chance of spinal stenosis, which is bony growth formation or osteophytes that develop from degeneration over the years. And that kind of causes some of the similar symptom patterns, different condition, different treatment plan, different treatment options and things like that. But typically with a disc herniation, your sweet spot is in your early 20s to your late 40s, give or take. Everything's give or take here with the ranges. And then with the spinal stenosis, usually 50, 55 or so and older. So those are some of the common low back conditions that we deal with, and when that'll help guide us the rest of the way. Here's a little more information on discs that we've already discussed, so we'll kind of move through that. And this is where the lower cross syndrome comes into play, and it definitely is something that we see a lot, and it helps guide us with our corrective exercises many times. And what we're seeing here with the lower cross syndrome is tight hip flexors, tight low back, weak abdominals, and weak glutes. And it's a cross, so it's basically tight hip flexors and tight low back, which is a diagonal cross, and then weak abdominals and weak glutes, which is another one. That's why it's called lower crossed syndrome. And essentially it can lead to low back pain, mid back pain, hip pain, lower extremity pain, all kinds of things that happen. And really what's happening in the desk worker is you're getting tight hip flexors from sitting so long. When you sit in that seated position for prolonged periods of time, that hip flexor shortens, and it kind of tells the brain that they're active. And so to give you a kind of an example, if I wanted to do a bicep curl, my triceps would have to relax, correct? So that's to move the joint. And your brain does that really, really quickly, and it's called neurological inhibition. It basically neurologically inhibits the antagonist or the opposing muscle. And so what happens is when you try to contract that bicep, it shuts off that tricep. Well, the same thing happens if you're sitting a lot. Your brain's getting feedback that says the hip flexors are contracted, so it is actually shutting your glutes off. And weak glutes are one of the biggest problems we see with low back pain. You know, we a lot of times will call the glutes the king. You know, glutes are king, because if your glutes aren't activated well, aren't strong, aren't stabilizing, then it really chews up the low back a lot. And so you can do glute bridges and all kinds of good glute exercises until you're blue in the face, but if you have really chronically tight hip flexors, it's shutting them off and causing this chain reaction. And so I really wanted you to understand this lower cross syndrome, and that the exercises that we give you in this presentation are for that. So let's kind of move forward with that in mind. Okay, the lower cross syndrome. All right. Before we get into anything else, I definitely wanted to touch base on, I get this question a lot, like when should I go see someone, or who should I go see? But here's when you should have your pain evaluated, okay? The warning signs, which just means, you may consider it for sure, depending on some things, but if you're having chronic back pain, if it's longer than a few days and it's bad, or if it's on and off for weeks, or if it's acute, like it just happened yesterday, but you have a history of, say, surgery in the back in the past, or anything else like that, or a car accident that just happened, those are things you should definitely, keep into consideration. As far as an immediate referral, if you're getting radiating leg, arm pain, numbness, tingling, remember we talked about the difference between radiation and referred. If you're getting those symptoms, definitely want to get the pain evaluated. If you're having loss of range of motion, like you just can't move your back well at all and it's not getting better. If you're getting weakness in the legs, that's definitely a sign to get it checked out. If you're having a past medical history, like we mentioned, like you've had surgery or something. If you're getting a loss in bladder or bowel function, that's definitely a sign to get it evaluated, okay? Because when you get issues in that area, you can start to affect the bladder and bowel function. So definitely take that into consideration. Or if there's any trauma, car accidents or bad falls, falling off horse, sports injury that happens, you definitely want to get it evaluated to make sure. So keep that in mind. If you're dealing with anything, it's highly recommended if you get any of those red flags. Okay, so we talked about, with the lower cross syndrome, we talked about the muscles and the fascia mainly, okay? This is going to go into the joints. So everything we look at, we're looking at joints, we're looking at muscles, we're looking at tendons and ligaments. I'm not going to belabor this diagram. It looks a little scary, I know. But essentially your body is pretty interesting, and it alternates for the need of mobility and stability in the joints. And so I'm going to work my way up from the foot, and I'll just end at the mid-back for the sake of this presentation, focusing on the lumbar spine. But your foot needs stability. You've heard of people with flat feet or overpronation. That's a problem. And a lot of times we see that, but it's like building, if you have a flat foot, that's like building a house on quicksand and you don't have a stable platform on to move. And it causes all kinds of things all the way up the chain. And so it's definitely something that we always look into. And we want to have, really good stability in that foot. Moving on up, we want to have good ankle motion. Again, we don't want laxity in the ligaments. Like we don't want a bad ankle sprain have so much motion. We just want normal motion, good ankle dorsiflexion and plantar flexion and things like that. Moving up to the knee, we want stability in that knee, which I think we all know. Going up to the hip joint, we want good range of motion. One of the first things we check with back pain is the hips to see how they're moving. And a lot of times with older folks that are dealing with a really bad hip arthritis, they're lacking range of motion in that hip, and then it kind of starts to chew up the low back. Moving up is the lumbar spine, or core stability. Everybody's heard that. So we want stability in the lumbar spine, and we want mobility in the thoracic spine. So taking those three things right there that are adjacent to each other, the thoracic spine, the lumbar spine, and the hip, if, say, the hip's not moving, you're going to get the excessive motion at the lumbar spine, which is not what it wants. It wants to be stable, correct? If we're getting no motion in the mid-back and we do something like golf or tennis or sit or whatever, then we're going to get a lot more requests from the low back to do the motion. And so we always want to check to make sure we're getting good motion in the hip, good stability in the low back, and good mobility in the mid-back. And so that's the alternating pattern of mobility and stability. And this helps guide us with our correctives. And so I'm giving you this because I always feel like to really be able to prevent certain injuries from happening, whether you're a runner or you're a desk worker or whatever, you really need to understand why this happens, so then you can apply those principles to your correctives and just realize why you're doing it. So it's not just like blind faith, and this really helps show that. All right, so now getting into some of the actual correctives for you. So how do you address and prevent the low back pain if you're a desk worker, right? Number one is proper desk ergonomics. We're going to touch on it a little bit. I'm not going to belabor that. We've done webinars already for that, and your company does have access to that, and we have plenty of resources for it. But I will show you a link to where you can actually take your own 20-point desk ergonomics assessment, and it'll actually generate a report for you, and you'll have all the tools right there to fix your workstation, to properly have yourself fitted to your desk, chair, and your computer. So that'll be great. The really, really key thing we came up with a few years ago, we were actually working with a furniture company on low back issues, and we really needed to, instead of trying to assess every movement that they do or every movement that a person does in their life, because people ask me all the time, like, oh, how should I do this activity, like brushing my teeth, or how should I pick up my kid, or this exercise in the gym, or this movement at work. It's just impossible to dissect everything out. It's just too cumbersome. So we came up with the strategy. There's 3 things that if you apply these 3 things to any movement or activity, you're going to protect the lumbar spine. You're going to put less stress on it. And that's where we move on to the abdominal brace is number 1. And it's basically a super stiffness of the lumbar spine. It's a muscular corset all the way around, from the butt to the low back muscles, to the obliques, to the QL muscle on the side, to the abdominals. You really have a good muscular corset around the spine, but it's just people don't use it. And abdominal bracing really is, I'm doing it right now, and I can breathe and I can talk, and it's just envision if someone were to kind of give you a little stomach jab, you would brace your abdominals. You would kind of exert a little bit of force there, and that would give you a muscular support all the way around, and it protects your spine. So if you're doing any type of movements, or you're in the gym, or you're even sitting, you can work on this. You don't have to do it all the time, but if you're brushing your teeth, just anything, if you work on just doing a quick abdominal brace, you will really help protect that lumbar spine. So that's number 1. Number 2 is the power zone. And again, if you're picking up your laundry, if you're picking up your child, if you're picking up something at work, if you're picking up a weight, a dumbbell off the ground, whatever it is, if you keep things in your power zone, which is below the shoulders, above the hips, or not too far out and reaching, about 18 inches out or so, if you keep it within that, that's your power zone. That's where you're protected. That's where you're strongest. That's where everything's going to be ideal as far as your carrying strength and protection. And so make sure you always are doing the power zone on whether it's at work or activities of daily living. Third is sternum up. We were really trying to figure out a way, how do we teach people neutral spine? How do we teach people hip hinging? They're both so important, but they're hard to teach, and people to cue them properly. And sometimes cueing is the best thing you can do. And the easiest you can make the cue, the more they're going to follow it and really implement it into their life. And so we came up with sternum up, which just means, sternum is the chest bone there. If you keep your sternum up, it automatically sets the body into good posture, and it maintains that neutral spine. So it maintains those curves that we talked about, cervical spine / neck in a lordosis, the mid-back thoracic spine into a kyphosis, and the lumbar spine into a good neutral lordosis. And that's going to help, remember, maintain 16 times stronger throughout, which is really helpful. And then it also will automatically help you maintain a hip hinge. A hip hinge is bending. If you see the middle diagram here, that person squatting, they're squatting at the hips. They're not bending over at the low back. I think most people know that. Even when you're brushing teeth, you'll see some people brushing their teeth and they're bending down on their back, and it's just killing the lumbar spine. And so the hip hinge really is a good position to be in. And when you just think sternum up during activities, whether it's sitting or any movement or picking up things, if you can really think about that, it's going to put you into a really good spine position. So those are the 3 things, the cues that you can do to protect your spine during all activities. So to kind of recap, 1 is ergonomics, and 2 is sternum up, which is really, really helpful. The body positions. And then the third way is corrective exercises, okay? I'm not going to go through each one of these. You have access to this presentation. You have access in the Learning Center to posture correction phase 1 through 3. We've got videos and descriptions of all kinds of exercises, and so you have access to that. But these are exercises for the low back, and very helpful to correct that lower cross syndrome that we discussed. I'm just going to kind of scroll through those. A bunch of good little exercises to do. If you implemented these 3 to 5 days per week, you could do it at the gym. Great. If you're doing yoga regularly, you're already doing a lot of these, and that's going to be a very good form of corrective exercise. Pilates, the same thing. Good. Now, number 4, the fourth way of actually helping to protect the lumbar spine is taking your micro breaks. So about every hour, getting up and doing a set of stretches and exercises to break up that monotony of sitting and break that overuse cycle. Okay, this is some of the, I'm going to kind of breeze through this. This is that self-assessment you can take, and here is the digital assessment you can take. It is at www.healthfitcorpwell.com/self-assess/. Really, really easy way of understanding your workstation. Good. And you got the Ergonomics Learning Center here, like I mentioned. And if you are with one of the corporations we're working with, then you have access to this. Perfect. All right. That is the end of today's webinar on understanding and preventing low back pain. Implement those 4 solutions to really give yourself a fighting chance against the sitting aspect of your job. Have a great week.